Hi there. Welcome to Doc Talk. Doc Talk is the Knoxville Academy of Medicine podcast where we talk about health issues affecting all East Tennesseans in plain language. So glad that you are here to join us today. And joining us, we have Dr. Stone Mitchell, who is a vascular surgeon associated with Premier Vascular Surgery in Knoxville, Tennessee. Glad you can join us today, Stone.
Thank you.
Tell me what's up with hemorrhoids.
Well, 50% of everybody in the world has hemorrhoids. And,
I don't know why I'm laughing, but
and they can certainly be a pain.
no pun intended.
No pun intended. And what we do is we have a non-invasive hemorrhoid treatment center that I'm the director of. And we are able to treat probably 80-90% of hemorrhoids without surgery. That tends to be a very gentle, painless procedure and very effective.
Okay, so I'm going to back up a little bit.
Okay.
Okay. I've been doing this a long time, medicine. I remember when I was in medical school and they would say, well, you just tie a thread around the hemorrhoid. I'm like, what? So tell me, what is a hemorrhoid?
A hemorrhoid is an engorged vein. We have a hemorrhoidal venous plexus in the area, in the anus, that is the normal anatomy. Mm-hmm. And as that engorges for things that increase venous pressure, like pregnancy, then it dilates and it then becomes a hemorrhoid.
Okay.
And so it's a swollen vein.
Okay. Around the rectum, in the anus, where you sit down.
Yes.
And that's why it hurts.
And that's why it can hurt.
Okay. Do they rupture?
They can bleed.
They bleed.
Hemorrhoids typically can bleed. They can swell and prolapse. They can be uncomfortable because they engorge. They can have a throbby, full sensation. They can sometimes itch and burn. Mostly it's bleeding and mild discomfort and prolapse. Sometimes a hemorrhoid, an internal hemorrhoid, can engorge and push to the outside and get caught on the outside and clot, and we call that a thrombosed hemorrhoid. People will notice that because it's a lump just on the outside that's very uncomfortable.
Oh, so you don't see hemorrhoids sometimes?
So the internal hemorrhoids, unless they prolapse, you do not see them.
Oh, so you can only have symptoms of like itching and discomfort and pressure.
Correct.
Does it stop you from going to the bathroom?
No, it does not.
No.
Sometimes it can be a little uncomfortable if you have certain little issues with it that might make you want to not go to the bathroom, but no, it doesn't prevent that.
If you have, do they come single or do they usually come in clusters?
Well, the anatomy of the hemorrhoidal plexus, in most cases, when you look inside, a very short little distance inside, we'll usually see a engorged hemorrhoid in either all 3 or all 4 quadrants, which would be like top, bottom, right, and left. So most people will have more than one internal hemorrhoid. Most will have 3 or 4.
Okay. And so you were talking about being able to treat them with, before we get to that, what about all those stuff that you see at the drugstore?
It's a very good question. And what I tell my patients is, as a rule, the salves, the creams, the suppositories, the steroids, they do very little to improve a hemorrhoid. They certainly do not make a hemorrhoid go away. Sometimes they can minimally improve the symptoms temporarily, but for the most part, the single best thing to treat the symptoms of a hemorrhoid are get off your feet, prop your legs up. That decreases that venous pressure, and hot water. I have my patients draw a good hot tub of water, lay down and soak 15 minutes, and do that several times a day. The moral of that story is I tell my patients hot water is your friend if you have a hemorrhoid problem. Simple, easy, the cheapest thing to do, and the stuff you get off the counter it helps minimally at best.
I think I would like it treated. I don't have enough time in my day to do that. Hot water. That would be hard to do.
And that's why we see so many. It becomes I'm sick and tired, and I want something done. And generally with our website, people see it and realize maybe there's an option, because most people have heard the horror stories of the conventional hemorrhoidectomy, which I have certainly performed in the past, and it is very uncomfortable. With this non-invasive treatment that we're able to treat most of the hemorrhoids with, it's very gentle. The laser that we use does not hurt your tissue, so nothing has to heal afterwards, and there's really no pain afterwards, so there's no follow-up restrictions, there's no change of diet. I basically send people out and recommending to them that they do whatever they want.
That is wonderful. Tell me a little bit more about the non-invasive laser treatment now that we have for uncomplicated hemorrhoids. What does the laser do?
Well, it's called infrared coagulation. It is an infrared wavelength that generates heat. And this little probe that generates the heat, we laser the base of each hemorrhoid, usually 4 little shots at each base. And what it does is that heat penetrates the lining of the anal canal at the base of the hemorrhoid without hurting the tissue, and coagulates the very small venous tributaries that feed that hemorrhoid, which is a vein, and it basically cuts the blood supply off to it, and it shrinks up. We call that ablation. Many times we have to repeat or do this treatment 3 or 4 separate times to thoroughly treat it, and each treatment takes about 5 minutes.
That's wonderful.
Requires no anesthesia.
So it's kind of like varicosities, isn't it?
Yes, it's the varicosity of the anal canal.
Wow. Okay. So 3 or 4 treatments, which makes sense because sometimes there's a lot of feeders.
Correct.
A lot of different little veins that are contributing to the problem. But they can go to work after the treatment.
Absolutely.
Okay.
They can walk out of the office and go directly back to work.
Will insurance cover for this?
Yes.
That's great.
All insurances do very well with it.
And it is less risky than traditional hemorrhoidectomy.
Sure. We speak of risk of bleeding, infection. We just don't see that. It is very, very safe.
Fabulous. What if people are is there any medication that they shouldn't be on when they...
If someone is on a blood thinning medicine, like so many are nowadays with heart disease and stents and their own long-term anticoagulation, we'll have them hold that for a couple of 3 days prior to the treatment, and then after a day after the treatment they go right back on it. And that's just as a safety precaution. It's not a big issue, but we do it.
Okay. You mentioned 3 or 4 treatments in quadrants, because you can have hemorrhoids around the entire circle of the anus. Do they come back?
Rarely.
Okay.
We've been doing this now for 7 or 8 years, and we have a few patients that will come back with a recurrent symptoms that's usually much less than before, and we'll do a little more. I call that a touch-up. But I would say that on routine hemorrhoids, the hemorrhoids are really divided into 4 sizes. There's the first degree, which are tiny. They are inside. Most people don't even know they have those. As it gets a little larger, it can become a second degree, which means it can prolapse or protrude temporarily, like after going to the bathroom, and then go right back where it belongs without any help. That's the second degree. Most hemorrhoids are first or second degree. As they get bigger, a third degree, they can come out but have to be helped back in. They need to be reduced. We don't see many of those. The fourth degree are the very large hemorrhoids that are out that you can't even get back in. And those are the ones that do still need surgery. Some of the third degrees still need surgery, but the majority of them are first and second degree, and we successfully treat those greater than 90% of the time.
So it sounds like if you have hemorrhoids, better to catch them early and treat them early.
Correct.
Before it gets to be more of a problem, because you wouldn't want to have surgery. So can you see them on your routine colonoscopy?
Yes, colonoscopy. The GI doctors doing colonoscopy, of course, they look at the entire colon, but going in, they see the anal canal as they go in, and yes, they can be seen through the scope and through their little monitor and their little TV camera. They can see it. I visualize it, I think, even better because I'm able to look at it with my eyes. You know, I have a little small scope that lets me just directly look at it. So I get a really nice view of it, so I know exactly what we're dealing with.
Well, that's great because, you know, everybody gets a screening colonoscopy, and
Yes.
if they know that they have some symptoms of possibly hemorrhoids, they can get that checked then and make sure that they can catch it early.
Sure.
Well, that's wonderful. Okay, and the insurance will cover for it.
Yes.
What if they don't do anything about a 3 or a 4 hemorrhoid? Is that life-threatening?
No, it's just the symptoms. It can just be a nuisance, and certainly people can live with it. But if they get, again, sick and tired of it, it can be treated, and usually one way or the other it can be solved. You know, and there's a couple other things that we can see. We alluded to the thrombosed hemorrhoid. That's usually an acute problem. It comes up and swells and can be painful. And fortunately, the majority of a thrombosed hemorrhoid with soaking will slowly go back down and doesn't require any immediate treatment.
Really?
And a few will open themselves and our patient will see bleeding. And then a few will remain large and very painful. And with a little local anesthesia, I can make a little tiny nick and tease that little clot out in about 30 seconds and relieve that discomfort. And then after the thrombosed hemorrhoid resolves over a period of a month or so, then we will go back and do our laser because the internal hemorrhoids that cause this are still there. So we ablate that so they don't get a recurrence.
Okay, what about infection?
We just never see infection from it. People can get a rectal abscess, but that is totally different than a hemorrhoid, so we just don't see infection with hemorrhoids.
That's phenomenal. Yeah.
You know, a final thing that we see very commonly is a thing we call a residual hemorrhoidal anal skin tag. That's the outside part, and most people think, and it can be considered an external hemorrhoid, but it's really stretched out skin, many times from pregnancy. And that is a huge nuisance for people. It is a hygiene problem. It stays irritated. that previously that was treated with the old-fashioned hemorrhoid surgery. Now we ablate with the laser the internal component of that tag, and once we ablate that, then I'm able, with a little local anesthesia, to snip that tag off in the office, put one little dissolving stitch in it, heals up in about a week, and it usually doesn't slow you down. It's just a tiny little thing. I call it Band-Aid surgery without a Band-Aid. And we're able to do that in about a minute in the office. And so we're able to take care of that. And we see that so many people come in with hemorrhoids, and part of it is they have those outside tags that they've lived with for years. And again, they get sick and tired of it. And they find us and we can take care of it.
That's really fantastic, because just to be free of that nuisance, yes, and the hygiene issue with our busy lives today. Right. If you think you have hemorrhoids, can it ever be a sign of something deeper going on?
It could be. Hemorrhoids never turn into another problem like a malignancy.
Okay.
But sometimes a malignancy there can mimic a hemorrhoid.
Okay.
Most commonly a malignancy of the anal canal, or a thing we call squamous cell carcinoma right at the anal verge can sometimes be mistaken as a hemorrhoid. And we see that, I identify that immediately, and that we refer that to our surgical oncologist. That usually will do a little brief biopsy, and then most of the time that can be treated with radiation and no major catastrophic surgery. But so it can be mistaken for a hemorrhoid, but it's not that the hemorrhoid becomes a problem.
Okay. Final question. The laser treatment for the hemorrhoid, is there a prep?
Good question. There's no prep.
Yay!
It's very simple and requires no prep, and actually we spend more time explaining and talking about it and giving instructions and what to do. The treatment itself usually takes 1 to 2 minutes.
Thank you. Okay. Thank you, Dr. Stone Mitchell. If we have more questions, how do we get a hold of you?
Well, easy to get a hold of us. We're at Premier Surgical Associates. We have our website. Our treatment center is at our Paper Mill campus, and our phone number is 588-9952.
And there you have it, Dr. Stone Mitchell telling you the ins and outs of hemorrhoids, and may all your hemorrhoids be blessed and ablated. And that's a wrap.